right, dramatic personality disorders. This is our second cluster of personality disorders that are characterized. This one is characterized by high levels of emotionality and emotional instability in terms of dealing with these individuals. Um, it's all about the drama, right? It's dramatic. So we don't necessarily understand super well why these disorders occur. We don't, uh, with one exception for one of the disorders, we don't have a ton of therapies that are super effective. So let's talk about these, right? So we've got four of them here: antisocial, borderline, histrionic, and narcissistic. Okay, antisocial personality disorder. These are folks who, in common terminology, are classified or called psychopaths or sociopaths, right? Those two words, even though they're very commonly used, are not actual diagnoses. Those are not terms that are used in any particular diagnosis, but are rather just general terms to say, hey, this person's a problem, right? But the problems that are generally referred to when you call somebody a sociopath or a psychopath are the problems of antisocial personality disorder. Um, these are people who simply don't seem to care about other individuals in terms of taking care of them, being kind to them, allowing them to have their rights. So they are tend to be liars, right? Even compulsively lying about things they don't need to. They can be violent and cruel when it suits their purposes. They tend to have high rates of use disorders, substance use disorders, and alcoholism. Um, Now, you can't actually get diagnosed with antisocial personality disorder until you're 18. Uh, because some of these, and you'll see this again with a couple of our other disorders, some level of self-centeredness, which is one of the commonalities of all of these dramatic cluster disorders, some level of self-centeredness is to be expected during the teen years, right? That is part of how the brain develops, is to really understand and center your own perspective before you concern yourself with others. Um, and so that's just part of the growing process. And so you may see some reckless lying or even high levels of unkindness to others during the teenage years, and that person may grow out of that entirely. It's not necessarily a disorder, but just, they didn't quite understand the other person's perspective yet. They were too focused on their own needs and their own perspective to be able to take it into account. So really, this is something that we're dealing with adults when we're talking about antisocial personality disorder. We got 3.5% of U.S. adults with antisocial personality disorder, 4 times more common amongst men than it is women, perhaps unsurprisingly. Why it occurs, once again, you've got different explanations based on the different perspectives. From a psychodynamic point of view, it's a lack of parental love leads to a lack of trust. And then if you can't trust anybody, then you sure shouldn't give them what they want, and you should be getting what you want, right? From a behavioral standpoint, your antisocial behavior is learned by operant conditioning, depending on what environment you're in. If you are getting rewarded and getting positive outcomes when you hurt people or lie to them or are self-centered, then that's likely to occur again. It can also happen through modeling and imitation, right? You see other people behaving this way, and so you do it yourself. Cognitive standpoint, it has to do with how you're thinking, right? Are you able to understand another's point of view? Are you able to bring that to mind when you're interacting with others? Or are you instead irrationally more focused on your own point of view, and that's causing problems? Um, from the biological point of view, there are some studies that show that we've got lower levels of serotonin activity in folks with antisocial personality disorder, and some of their brain circuits are not put together quite the same way as the average individual. We're still trying to figure out exactly what's going on there, but there do appear to be some genetic factors involved. Um, How do you treat it? Well, get people involved with others. You educate them to on how others are feeling and how they're thinking, and on the effects that treating people negatively are likely to have in the long run. In some cases, psychotropic medication can help, but generally speaking, it's hard to treat this one because these folks don't care what you have to say, right? They are centered in their own perspective and don't much care what anybody else thinks or whether or not other people are displeased with them. And so as a result, it's pretty hard to even seek treatment if that's how you're feeling, and certainly hard to stick with treatment even if somebody else is forcing you to go, because you don't really care what the therapist is saying. You're fine with yourself, right? Okay, borderline personality disorder. Um, this one is more common amongst women. You've got 70%, 75% of diagnoses going to women here, about 6% of adults overall. What we're dealing with here is instability of not only mood, but also self-image and levels of impulsivity, right? So this is somebody who you're never sure what you're going to get from them, because sometimes they might have it together and they might be on top of their work or their schooling and their relationships and be taking good care of everybody and be pretty reasonable. And then the next time you deal with them, they're totally out of control and acting differently, feeling as if they want different things and have different goals than they did before, um, treating people differently in terms of their personal relationships, taking advantage of them, lying to them. Um, and these folks tend to have a hard time managing their anger, and as a result, these folks tend to enact higher than normal levels of violence, may harm themselves as well, right? Um, and This can be really hard to put up with, and hard to handle. I actually have somebody in my extended family who has been diagnosed with borderline personality disorder, and she's super difficult, right? She got kicked out of her parents' house, um, is in and out of relationships all of the time, is frequently moving, always changing her cell phone number, has a hard time paying her bills, keeping jobs. Um, Always there's someone who has wronged her at her job, and she ends up getting fired. And then she'll go through long stretches where she really connects well with the family and is interested in coming to family dinners and things like that, and sort of pulls it back together and is doing well in school and all that. Um, and this kind of instability makes it really hard, as you can imagine, to manage your relationships and keep things together. And so these folks really tend to struggle. Now, why does this happen? From the psychodynamic perspective, it's all about your parental relationships, right? Were you treated well? Was there instability in your treatment when you were a child, specifically, right? Were you not sure what you were going to get from mom and dad? Sometimes they treated you well, sometimes they treated you poorly. Um, and so, object relations theory is actually a subset of psychodynamic theory. But um, if you're dealing with a lack of acceptance or with abuse or neglect from your parents, um, that then they feel like leads to the development of borderline personality disorder, and there is some research support for that. So, from a biological standpoint, there is some suggestion that genetic predisposition matters. Right, so you're somewhat more likely to develop it if you have relatives, close relatives, who have this disorder as well. Um, Once again, you've got lower levels of serotonin activity and abnormal circuits in the brain. Um, Socioculturally, you can talk about the rapidly changing social norms and the instability that that can lead to, in terms of you've got some folks who are very concerned with managing and matching social norms, and if those norms are changing, that can lead to an instability of both mood and reaction to others. That one has, there's less support for that one, but it's an idea, right? Um, We have had some more success with borderline personality disorder in integrating some of these different perspectives together. So looking at it, not just the biological, but also the social, where you're dealing with someone who has a predisposition already to this kind of behavior and this kind of instability, and high levels of emotionality, right? So strongly reactive emotion circuits in the limbic system that then have to deal either with unstable home situations or with parents who don't teach them to control those emotions. Um, and that can then lead to feedback loops of uh, inappropriate emotional behavior that then gets reinforced by parental either example or response. Now, how do we treat it? Some of the most effective treatment has been dialectical behavioral therapy, which is an offshoot of cognitive behavioral therapy, in which you recognize that there are certain emotional situations that the person is going to respond to more strongly and more quickly than the average individual, and certainly more strongly and quickly than the people around them. And so the people around them are going to freak out because they're freaking out, and that's going to lead to problems. And so you teach the person to recognize the situations in which this is likely to occur and gradually help them work through what is the irrational thinking that they are engaging in, what is the behavior that is actually causing problems. Let's isolate that and try and teach you different ways to approach these situations. And it tends to be pretty intensive therapy where you got to be, not only having a weekly session with a therapist, but also then a weekly group session and a couple of call-ins with your therapist as well, where you're talking about how you're managing your day and what's working and what isn't working. Um, there's a variety of drugs that can reduce the strength of the symptoms that the person is experiencing as well. These folks tend to have pretty high levels of anxiety, so anxiolytics are sometimes useful. In other cases, antidepressants or antipsychotics can help reduce some of the mood swings. And it's not just a question of mood swings, right? We all know somebody who's a little unstable who, jumps down your throat right after they were happy. Um, that in and of itself is not necessarily borderline personality disorder, although these folks do that as well. Um, there's also a question of instability of how you view yourself, right? Who are you and what do you want and what are you pointed toward? These folks have a hard time settling on an answer there and may vacillate back and forth between I'm a responsible student, I'm a good daughter or son, um, I keep it together, and screw all you people, I'm going in another direction, right? Um, anyhow, okay, moving on to histrionic personality disorder. These are sort of stereotypical drama queens, for lack of a better term. Um, these are folks who need to be the center of attention all of the time, um, and so will engage in attention-getting behaviors even when it's inappropriate. Are constantly seeking approval and praise. They are demanding in their relationships, and frequently will manipulate others in order to maintain social dominance and the center of the room, right? Even up to and including suicide attempts, right? So this, interestingly, is 4 times more common in men than in women. So um, this is I mean, you've probably dealt with 1 or 2 of these people in your life where they simply are not okay unless they are stirring up trouble or in some other way keeping themselves in the center of the ring. And it can be honestly very damaging to interpersonal relationships, and it can be hard to keep jobs dealing with this sort of thing. Why does it happen? Psychodynamics says it's because of cold and controlling parents. You fear being unloved and you fear being abandoned, And so therefore you act out in dramatic ways to try to keep the attention of folks who are neglecting you, right? Um, from a CBT standpoint, you've got um, the lack of substance and extreme suggestibility tied to self-focused and emotional behavior. To be quite honest with you, I'm not exactly sure what that means. This is one I need to read up on a little bit more, if I'm being honest. From a sociocultural perspective, obviously this stuff is going to be influenced by social norms and expectations. If depending on how allowable it is in your society to seek the center of attention, right? And you find pretty severe differences there between individualistic versus more communal societies, right? Where you're supposed to be a member of the group rather than the individual. How do we treat it? Well, we focus on, if you're a cognitive theorist, the assumption of helplessness, so that if you need other people's to meet your needs, then that's an irrational assumption, and you need to focus on that and realize that you can do some things for yourself. You don't necessarily need to be praised for everything, and need other people to be watching you and taking care of you in order to be able to be okay, right? That's an irrational assumption. You need to handle that. Now, from the sociocultural perspective, that same expectation, the of social norms, um, that may then feed into and interact with people's irrational assumptions, right? You may be misreading the room, so to speak, or misreading the culture. And maybe the way that you are behaving you think is okay, and turns out it isn't. And so that kind of irrational assumption can be addressed as well. Great. Let's talk about narcissistic personality disorder. These are folks who don't just need to be the center of attention, but think that they are the best, right? They not only need others to admire them, but need to have an inflated sense of self, an inflated sense of their own importance, and that is married to a lack of empathy with others. They will frequently overstate or even misremember their own achievements in order to make themselves seem more important. They tend to manage their friends and manipulate their friends extensively, to the point where they will arrange scenarios to their own liking so that they can make positive first impressions. And frequently, people do have positive first impressions of narcissists. I think that has been copied over and should be, that belongs to histrionic, not narcissistic. Yeah, that was on the other side. That shouldn't be there. Sorry. Boop. Okay. Now, once again, some level of narcissism, not uncommon during the teen years, that centering of the self and a lack of experience that leads to an inflation of one's own accomplishments. If you remember the sensation of being a teenager, everything's a big deal, right? And everything you do is a big deal, and why doesn't everybody see that? So that is very much in line with the narcissistic personality. But once again, this is going to be something that isn't going to be diagnosed until adulthood, because you're supposed to grow out of that. You're supposed to realize, oh wait, I am not a special flower. I'm pretty much just like everybody else. That stinks. I get used to it. Welcome to middle age. Folks who don't grow out of it then tend to have a hard time in the long run managing their relationships and keeping their jobs and managing their lives, because they make a mess wherever they go, because they're lying about things. They are disregarding others' contributions, or even attributing others' contributions to themselves, And those tend to be people who are difficult to deal with. Although in some cases you get people who are able to ride that train pretty high and end up in positions of extreme importance, despite a lack of a clear view of reality. So there you go. Now we've got another error here. I really need to clean up these slides. It's not that 75% of men are affected by narcissistic personality disorder. That is incorrect. Up to 75% of the diagnoses of narcissistic personality disorder are male, right? So you got more men than women being diagnosed, but about 6% overall. Okay, why is it happening? Psychodynamics says cold and rejecting parents. Are you seeing some commonalities here in this dramatic cluster? It's problems with your parents and them not paying enough attention to you. Now, if you talk about object relations, then it's a question of dealing with that rejection by creating a grandiose self-presentation. I'm awesome. Pay attention to me, and that works well enough to actually get the attention of mom and dad that overcomes the cold and rejecting thing, right? Now, from a cognitive behavioral standpoint, this apparently can develop from either being being treated too positively or too negatively as a child, right? That leads you to either overvalue yourself if you're treated too positively, or to reactively overvalue yourself because you are being treated too negatively, right? They say I'm not worth anything, so I'll show them I am worth everything, right? And so either end can end up pushing you to the high end of self-appraisal as far as that perspective goes. Socioculturally, you can talk about shifts in the society in terms of how allowable it is to be grandiose. Do we prize grandiose people? Do we reward them? You might say, and argue with some success, that we are in an era right now where self-aggrandizement and narcissism is strongly rewarded. And so those folks may be going untreated and may be then ending up in positions of power and importance rather than, being on the outs because they're causing problems. So, but that's going to wax and wane with the time. And those folks' time will come. And in the meantime, we just have to put up with them. Okay, how do we treat this? Well, we don't. Not really, not well. Because these folks don't want treatment. Just as much as the antisocial personality folks, in a very similar fashion. They think they're fine. They have constructed a view of themselves and of the world that puts them at the center. And why would you forfeit that, right? Why give that up? That sounds pretty awesome. So if you do get someone who happens to be amenable to treatment because they're depressed or otherwise, how would you treat it? Well, trying to work through a person's insecurity and defense mechanisms would be Freud's point of view. From the CBT point of view, you would focus on those irrational thoughts and redirecting those thoughts into more valid, more accurate thinking, right? But once again, none of these work super well because most of these folks aren't even coming into the office in the first place. There you go.